Okay, it's 5 o'clock. So why don't we call this meeting to order? Hope everybody's doing well today. First, we're going to have open time for the public. Going once, going twice, great. Okay. We are going to take a look at the minutes from November 1st to approve them. If you need to take a moment. That was a meeting where we had some people attending about possible expansion of sewer, which was great news. Contact tracing was approved through June, although Chris mentioned that they needed to vote to appropriate those funds for contact tracing. It sounds like now more than ever, it's going to be very important.
We're gonna still have to do that, but maybe you should I can draft a letter for you and, or I can do it myself and send it to the select board requesting that funding through June.
I think that makes great sense.
Just so it's on the record and we're sure, because we're going to have to continue contact tracing. There's zero doubt about that.
That sounds like a good plan, just because I want to make sure we obviously have a plan for that.
Okay.
Technology planning and monitoring COVID cases, so we'll certainly talk about that tonight. And if somebody would like to make a motion to approve the minutes from November 1st.
Motion to approve the minutes from November 1st, and I'll second that.
Okay. All in favor, Rooks, aye.
Kuderski, aye.
All right. Moving right along. So a couple people asked that we add the COVID protocols for the special town meeting to the agenda, and I think that's a great idea. Now, that's happening in the school auditorium, cafeteria?
Auditorium.
Cafetorium.
Okay, and how many people do you you don't know?
I would guess 120.
Okay.
You have to have 50 for a quorum. And I've already spoken with the fire chief and about disinfecting that room after the kids are out from lunch. And he suggested having all of the chairs already set up and they'll go in and fog it. And then it needs to be fogged again right after that meeting before the little kids go back to school the next morning.
And the official date and time of meeting?
Yes, the meeting is the 14th of December at 7 PM
Okay.
at the William E. Norris School.
So will there be custodian staff to do the disinfecting afterwards? Because they go pretty late, don't they?
Well, the fire chief or his crew will go in and fog the entire area.
Okay.
And then probably in the morning, the custodians will put all the chairs, everything away, I would guess. They do it first thing in the morning before the kids are there for lunch.
Okay.
And will there be room to space the chairs 6 feet apart in that space with 120 estimated attendees?
They aren't chairs, they're benches.
Benches, oh.
You're not having chairs in that cafetorium for the meeting?
No, they use benches in there. They use the...
The lunch tables.
Hold it
With a
up.
bench attached.
I thought we had chairs at the...
No.
Are people going to be facing the same way?
Yeah. Everybody faces forward.
No,
I'm
because-
just wondering if we could just, like, put
Marker?
little pieces of paper or markers, somebody...
You'd have to put a sheet of paper, with an X on it so that nobody sits there. It'll all have to be marked off 6 feet apart.
So it's only 2 per bench based on what they do during lunch at school.
Okay, so 2 per bench. As far as masking goes, so
You have to have a mask.
you have to have a mask, but if someone decides, and I'm just curious if there will be a plan for if somebody is really diligent about attending without a mask on, is there a way to seat them clearly 6 feet away from people, maybe, I don't want to say separately, but just
at the outdoor meetings, there was a section just for people who didn't wear masks. And so we could set up a separate section here or somehow separate the people, because it did happen in a meeting in this room and the police asked, separate the people.
I remember that.
And because it technically, the school is under our jurisdiction for the true mandate that's in place, which, correct me if I'm wrong, but it is, right? We cannot, like, 100% enforce that. I'm asking the question, like, can we say, like, you cannot enter without a mask?
You could. It's tricky because it's a public meeting.
Right.
I think probably the better thing to do would be to set aside an area for the one or two people who might really try to push the envelope.
I agree with that. I mean, do the best you can, right?
Otherwise, you have to do it with a no trespassing order, and, you know, it's difficult.
Sure.
Department and the,
What will happen in the event that there's more, especially if the benches are going to be the system, there's going to be people per bench, so what if more people come into the room than there are safe places for them? Is there an overflow space that can be used with AV equipment, or what would the plan be?
There is not an overflow space, no.
we did that before, though. I think we had another room with,
So would there be standing room permitted, or would people be asked to go home and watch a live stream? I'm just trying to figure out how that would
We
work.
have the bleachers on the side, but there's also standing room that would be available behind the benches.
Okay.
I think we just want to make sure that if there are people standing, that they still have clear guidance on spacing.
Do we know what the capacity of that room, I mean, the benches, and then...
we don't. I mean, how many people could you actually get in there safely?
And then divided.
I wonder if Mrs. Pluta has that information from last year when they were sticking strictly to the 6 feet. Maybe the school calculated that for students.
Yeah, that would be good information
How
to
many
have.
bodies you can
Right.
have on those seats?
Yeah.
Well, we could ask.
Yeah, I think I like marking the, anticipating that there might be more people, because and then the other question I had was, in terms of tracking attendees, is there going to be
They have to sign in.
sign-in? No, sign-in won't determine that's why I think either if we're going to go less than 6 feet, then we need to know who those people are, because in the event of contact tracing, if they are less than 6 feet apart, then they could be identified as a close contact.
Well, yes and no. It gets a little more complicated than that, because if you're vaccinated, then you may not be
Right.
considered a contact. If you just simply have everybody do the sign-in sheet, and then if we had some sort of full-blown issue,
Sign-in sheet.
then we have everybody covered.
Okay, and is there going to be any sort of system for, or signage about symptomatic people not entering, like, don't come in? I mean, I know it sounds very,
They're going to do whatever they want to do.
Right.
I'm not even in favor of having this meeting, frankly, right now, with the number of cases we've got.
Was it a decision made by, like, who decided to do the go-ahead for the meeting?
It's the select board who, it's their warrant, and it is the moderator's meeting, so
Okay.
the select board drafts or the town administrator drafts the warrant. I was hoping that it could be shorter, but I don't think, Francine, there's any way, I guess, to make it.
I think we pared it down into what we need to do now and save the rest of the spring, and hopefully we can be outdoors if we have to.
How recently was that reconsidered? Because perhaps if this was decided 3 or 4 weeks ago, we might be in a really different moment right now where we might want to urge them to reconsider this
Well, it has to
plan.
be, I mean, things have to be, some items, like they have to be, the warrant articles have to be out like 14 days, 21 days ahead of time.
Right.
I mean, this was planned.
months in advance.
had to be planned with of the date in order to meet what the state regulations are in terms of notification, information for the public and so on.
But we did.
And there's no pandemic exceptions for remote, to change to remote if in the case of
did it.
working
We cannot do
conditions?
remote.
You can't
Okay.
do remote, but we did this when our numbers were
Right,
really
yes.
low. We're now at 50 or 51 active cases right now.
Right.
Can we use the gym as an overflow room to have two big rooms going? Like you have the cafeteria as one and the gym as another to really try to
We've done
space
that before with a
with a
screen.
screen? Because that's a big room. That gym is as big as the cafeteria.
Right, it's
Why can't
bigger,
we
I
use
think.
two big rooms?
So what are the local numbers doing currently?
We're at 50, 51, another one today. So currently, those are the active numbers.
So it's clipped up considerably over the last couple of weeks.
Yes,
When have we
yes.
last seen numbers that high, Jerry, for Southampton?
I got them this morning from Sharon.
No, but I'm saying comparatively in this pandemic, when was the
Oh.
last time our rates were this high, like last winter perhaps?
Probably, yeah. It's as everybody goes inside.
Right.
And, you know, it escalates with the holidays. Everybody
Sure.
gets together. They want to go shopping. And people are tired of this. I understand that. But, and the other thing was the little kids. Yeah.
Our vaccination rates are pretty high, and so if you have a majority of people, obviously that are 18 and older, we hope that a lot of them will be vaccinated. I don't know what percentage, but hopefully at least, the benchmark of 70%, because I think that's what our town is. So we could estimate that 70% of the people will be vaccinated. I think just minimizing the risk of potentially close contacts is the best way to mitigate the risk. The other thing I was wondering about is I don't know if there's a lot of doors going in and out or things that, entryways or high touch points, but if those doors could be propped open so there's less
I think
people.
they're usually open.
Okay,
Yeah.
propping doors just so there's less touch points.
And I do agree that probably one of the biggest things is the need for overflow, because this meeting tends to be busier, especially with the projected numbers of like 100 people. And I can just envision it being, crammed with lots of standing, and that could lead to a dangerous scenario.
Well, you also have people that have to check people in too, so they're going to be close to people as they check them in.
So having like a solid overflow overflow plan.
Yeah, I agree with that. I think that the more people have to kind of figure that out themselves, the higher the risk will be. Now, talking, like what you said about the people being checked in, do we have plexiglass barriers? Is there some way we could set up a barrier just to help keep them safer?
I think they should be, those plexiglass barriers are movable, so they should be able to move them.
Yeah, we might be able to do that. Maybe Randall's got a couple of fellows that could move them. I think that's a good idea.
And I think we need to put this out to people so that they know what to expect when they get there, or have signage there when they come in.
We could say, please don't enter if you're having any, list out the symptoms, just ask. I mean, that's all we can do is ask. Have hand sanitizer and extra masks available in case someone, I don't know, forgets.
I've forgotten, for
Right.
sure.
Or so we can ask people to put a mask on, right?
Yep.
Well, there
During
should
the
be
meeting, when they hand the
signage
microphone
that says you need to wear a mask for this meeting, or, yeah.
That's a good point. I was thinking high touch points, but a microphone is,
The microphone gets handed around quite a bit in that meeting.
Is there opportunity for like a stand mic like we had at Labrie last year, where someone could go up to it instead of having like a,
There is one.
There is one.
Yeah.
okay, so the portable one is just like a second mic type of thing, so,
Well, we're gonna,
There aren't any portables at the town meetings.
Yeah, but are they going to handle it? You know,
Yeah,
that's what I meant, like touching
people
it.
go up and
Okay.
they hold it.
could ask people to sanitize. I mean, I don't know if that's too extreme, but you could offer hand sanitizer before people go up to the mic. I mean, look it up.
Just have, maybe somebody could just be there with a
Little wipe down.
little wipe down, just wipe it down after each person. Those sanitizing wipes.
I just don't want to, also deter people from voting. People do have a right to vote, right? So I think the more that we can portray ahead of time that we're trying to do everything we can to create a safe environment, I think will also help to encourage people to vote.
I think it's going to be difficult for older people, though. I think they're not going to want to come out, no matter what. I have a feeling.
Well, we have to have 50 people. That's the minimum.
Right.
Yeah, if you don't have 50 people, there's no meeting.
But we are looking for the recommendation. Okay, can it be shortened or can it be postponed? Good.
Well, what would be just to better understand, so I know that the park grant, as an example, needs to have a town vote by the end of the year, right?
Right.
So that's one reason that this meeting is happening before the end of the year. What would the other potential consequences be of deferring this vote to a later time?
That one and the canal vote are supposed to be by the end of the year. If the Board of Health, because of rising numbers in safety, were to say that, we prefer that it be postponed to, February, March timeframe, or when numbers are dropping, we can always turn around and see if those entities will entertain an extension until that time.
And that's a reasonable request, too.
Right?
I think that we're sort of disenfranchising some people that are going to be nervous about going into a room with 150 people.
I think Nicole's suggestion of having separate rooms would make a really big difference because it could potentially minimize crowding, right? The greatest risk comes from when you're within 6 feet of somebody else for 15 minutes or more, right? And so if we could minimize that risk as much as possible, we're going to minimize the risk of creating close contacts. In the school, they're usually using 3-foot distance for unvaccinated people, so,
Those are kids, so they're not getting sick as, older people or adults.
It would just probably require more staff because you need to be able to have people going back and forth between the rooms, right? To field questions and moderate and, right? If you had someone that wanted to go up to the mic and ask a question, you'd be in a different room.
We have to see if the other room is available, and we'd have to see if this technology to broadcast it in there too.
Do you think there's any value in the people that are involved with those specific votes reaching out to the entities, as you had mentioned, to see if it would be possible to postpone them under pandemic conditions with rising cases, or is that not something worth considering?
I don't know. We could certainly reach out to Melissa.
Well, I think, you don't know the answer if you don't ask a question, right? So I think that, if the question was asked, if it could be postponed until the spring, and I don't think that makes a huge difference. I don't know, what is the canal issue, Ed?
Oh, the mapping the historic, where the historic canal was.
So that's another grant?
It's another grant, yeah, it's
Okay.
done through PVPC. There's I think 6 different communities that are participating in it. We were the last one to approve the funding for it.
But I think that the question certainly could be asked, can we defer that, and have our vote in the spring, like March, when, hopefully we'd have more of the little kids vaccinated, more people would have their booster shots too. It just makes sense to me.
The infection rate will be lower.
Yeah.
And how long is the agenda approximately now, do you think? I know you said it was shortened.
There's 17
17
articles. It's long. And people are gonna wanna talk about this.
Just from my understanding, maybe you have a better understanding of the age demographic. So I know that a lot of the cases, Stephanie Foss said that there's 20 cases at Norris among school children. Now, do you have a better idea about what the demographic is of the,
Who goes to town meeting?
no, who the current positive cases are? By age group, like are a majority of the cases somebody who wouldn't potentially attend the meeting? Because if there's 20 cases in Norris School, there might be 10 in Hampshire Regional,
I'd have to go back and ask Sharon to break it out. I mean, certainly we had a number that were children, but then we've had a number that were the adults, and it just went right through the family. So I'd have to go back and,
I think the other piece of it, what you said, Jerry, though, is like the risk analysis, right? If someone's like 65, 70 years old or has autoimmune conditions, I mean, you look at this, the average age of death from COVID is 75. So an older person is going to feel like the risk is not maybe worth
it's not
attending.
worth it. And
Right.
essentially, they end up being disenfranchised
Right.
because they don't feel safe to go.
Right.
Actually, this graph shows that the number peaks at the 30 to 39 in the last 2 weeks, age range, and then continues
This is
to go down.
statewide?
Yes,
Yeah.
and that's massive, that's across Massachusetts.
That's the whole state, right?
That's the state, yeah.
Yeah.
And I'm assuming that our pattern may be similar, I don't know.
I just know, maybe it'd be helpful to have you also weigh in as a select board about what the work, for benefit of postponing that meeting, because the select board also put a lot of work into putting this meeting together.
Well, of the absolute have-to items, how many are there, 2?
What?
Of the items on the warrant, how many absolutely have to be done before December 31st? 2. I mean, then you could have your,
Well,
if you
that's,
want to, a 15-minute, half-hour meeting, if you move those other items to the spring. I'm just saying, that I don't know if it's a viable alternative or not, but that might reduce the amount of time that people are there, and get the business done that really has to get done, and not overextend it. And we did that.
I think there's some borrowing for a plow truck. I don't know if that's,
Time
they
sensitive.
might consider that
Well, everybody's going to consider their article.
pretty important, I
Right,
guess.
exactly. So, I mean, from that standpoint, there's 2 that absolutely have to be done. I mean, if the Board of Health's recommendation is to postpone it till the spring, if it can be, then we can reach out to the 2 entities and find out if we can extend those 2 that absolutely have to be done.
Well, it might not be the only town either.
That's an option, yeah. If that's your recommendation.
So I think, given the 3 options, that being 1, 2, potentially shortening the agenda even more so, which could run into challenges that Ed raised about, people wanting their articles to be included, or going forward with the meeting itself with, definite space for overflow, et cetera. So should we vote on what we all think?
I think it would be really helpful to know if there could be a way to designate space for overflow, because having people adequately spaced does mitigate the risks substantially. And making sure that we're creating a safe place for people to be able to vote, I think will make a big difference.
I don't think you're going to convince anybody over 60 of that. I think you're going to have a tough time, don't you? Yeah.
Yeah, I understand that.
Yeah, I mean, the thing that makes me nervous is obviously our town numbers. Like, this would be a completely different conversation if it was 3 weeks ago. But I don't think it's unreasonable, in my opinion, to see if we can extend the 2 grants that we're looking to have approved. And if that is a possibility, then in my mind, it's almost a no-brainer to postpone the meeting. But that's just my own personal opinion.
And they may be willing to extend it, and maybe you could even shrink, the warrant even a little bit more, make it really fast. I don't know. But I just think that we probably should ask the question, can it be?
And what's the worst case scenario? No, and then we know that this is something that's important we have to go forward with, and then at that point, we can decide with what we need to do, how we can make it most safe for everybody. And how fast of a turnaround time do we think the question would be answered?
Melissa's typically pretty responsive, at least from,
Well, Ed, you would probably call somebody and see if we can defer it.
Right, yeah.
They're either going to say yes or no.
Right,
Yeah, it's a week from tomorrow night.
right.
so if it's a no, then what? Okay, so say they can't defer those 2 particular articles. Then would the meeting move forward in an abbreviated manner, or would we just forego those 2? Like, that's,
I don't think we should forego the 2 grants. I think if they can't postpone those, then you would consider a abbreviated warrant and also inquire with the Norris School about the availability of the gym or another overflow space.
Yeah, I like that plan of attack.
Yeah, find out first.
So your order would be postponed, reduce the agenda, and find the last alternative would be to create the overflow space.
ensure that there's an overflow, yeah.
And that all depends on whether or not these entities will allow us to extend the due date on the couple of items that we really have to take action on. And that we won't know.
Correct. Okay. Anything else about the special town meeting COVID protocols?
I can't think of anything else. Can you? And
No.
is there anything that Robert's going to have any issues with, or that, if he has suggestions too, clearly.
Yeah, he's got somebody to volunteer to cleanse the microphone, so
Oh,
just
good.
thinking about that.
Well, he would have to make sure if it goes to the overflow that Sandy Keener's there for the other room.
Right.
So, well, we'll wait and see what happens after you call to check on the grants and see if we can just defer them until.
And if that can't happen and you need additional hands to help make it a safer environment, if the meeting ends up moving forward and you need more people to help keep the space as safe as possible, to help seat people, make sure people are appropriately socially distanced, I volunteer, obviously.
You don't need like ushers.
Right. Okay. Well, thank you for that discussion. Moving right along to health director updates.
Okay, let me see here what my own notes are. Well, as I just told you, we have 51 active cases at the moment. And the numbers are going up, which is unfortunate. There's free COVID testing at Easthampton City Hall, And the Holyoke Community College facility testing is going to continue through March 31st, and that information is on each of their city websites. There will be a COVID vaccine clinic this Thursday, November 9th, from 3 to 7 at the Norris School for the second round of shots for the school children, and also they will be making booster shots available, and I will put up the link tomorrow, or ask Ed to have it put up on the website, and Randall can put it on Facebook too, so people can sign in.
Can people get a first dose?
Stephanie didn't tell me if they could get a first dose or not. I'm not sure. I can ask her tomorrow.
And who's the manufacturer of the boosters?
She also did not tell me that either. I believe that it's all three, that it's Pfizer, Moderna, and Johnson & Johnson.
I think it was the last time, but they didn't, the reason I was asking about the first shots is because they came without enough vaccine, so I'm sure maybe there's still some people.
No, so I'll check with her tomorrow. I also suggested to her that she call the fire chief and just have EMTs standing by. I think that's a good idea, just in case. So,
And is that for school, Norris school affiliates, or is that for general public?
general public.
So we should definitely make sure we share that.
Are kids also in this 3 to 7 timeframe?
Pardon? Yes, yes.
Is it by appointment? Do people have to register for a time slot, or is it drop-in?
Yes, there's a link and you have to register.
Okay.
I did meet with the Hampton Ponds Association on the 18th of November, and also with the original design engineer of the sewer project that was done 20 years ago, that we paid over $300,000 for the design, and the sewer was never built. The engineers from Ty and Bond said they'll take a look at the original design. I had copies of the design, and see, give us an idea of cost for updating the design. And hopefully we could use some of the ARPA money for that if it's not too expensive. And going forward, we'd be able to maybe use the infrastructure money from the federal government also, because the people in the ponds area are concerned about the cyanobacteria, the blue-green algae, and frankly, the area is surrounded by septic systems. So it's a beautiful resource. We don't want to lose it. Two towns already on the Cape have been sued by the Conservation Law Foundation because they didn't move forward and do anything about sewering around the ponds. So we might want to be proactive in this case, especially if we have access to federal funding. It's an opportune time to get this done. And it was also made a part of the master plan. Goal number 6-3, make public wastewater sewer system available in priority areas. And I would consider this a priority area. And so they're going to get back to us, and we'll have another meeting. I'm guessing it may be early January, because we're right in the middle of the holidays right now. But it looks promising, which is a good thing. Then November 30th, Tuesday, Southampton Meadows had a major water leak and pipe burst. So the entire first floor had about 6 or 8 inches of water, unfortunately. So they moved people to a hotel, and the contractor was called right away. Faith Williams, who's the executive vice president, was right on top of everything. She was really very, very good, and stayed in touch with me and the fire chief and building inspector. So right now, the elevator's been inspected, the state inspectors come, it is operational. There are 11 folks right now in a hotel. They're going to take all the carpeting up on the first floor. That'll all be replaced. They are replacing everybody's food that, you know, in their refrigerators. They had a $200 gift card for everybody for groceries, I guess.
That's great.
You know, and they hired a moving company to take care of everybody's belongings and store them. So, and I understand it certainly is, you know, an inconvenience for those folks. But Wayfinders is doing a very, very good job taking care of this. And the fire chief's going out with building inspector tomorrow to do a walkthrough with the contractor. Contractor was there immediately. So, and they were moving people back in, I think, over the weekend, and the second and third floor people should be in today. Let's see, what else?
So that means everyone was back except for the 11 in the hotel?
Everybody's back with the exception of the 11 on the first floor.
There were
Correct.
still a few coming in today, and they were finishing cleaning out fridges and stuff.
Yeah.
I was up there on Saturday, and they had given every apartment had cleaning supplies, gloves, paper towels, big bags, and as they were emptying fridges, they were just taking the trash right out and helping everybody. They did a really nice job.
Wow.
And they were in there still today, because they still have the table set up to help people, so.
Great.
Yeah.
There's been enough floods this year, what do you think?
Yeah, yeah.
Yeah, it was just an awful thing to happen, but,
It's very disruptive for people.
right, they took great care of it. The other issue, we've had several complaints. People are unhappy that the private sector, the retail stores, are not mandating masks. And Holyoke is doing a suggestion, you know, like we did, recommendation. Most of the communities, I think Easthampton still has a mask mandate, but it's the private sector that has to enforce it, which means that, you know, the retailer would have to issue a no trespassing or have a no trespassing violation issued. I don't know how that's working in Easthampton.
So is it up to the individual retailer to decide how or if to post signage? Because if you go to Big E's, it says per order of the Board of Health of the City of Easthampton, masks must be worn. And like in Hadley at the Hampshire Mall, it says per order of Hadley Board of Health, masks must be worn. But I haven't noticed, maybe there is one, but I haven't noticed a similar sign like at Big Y in Southampton. So is that
There
just?
isn't one at Big Y in Southampton. If these communities issue that order, you can't really enforce it. The Board of Health is not going to enforce that. It has to be the private manager or property owner of that piece of property that does the enforcement. And that means calling the police department to have somebody removed. And I doubt that anybody's going to do that. And I think people in town here, I've had people say that they're not going to shop at Big Y. They will simply go into Easthampton. And, you know, maybe that is enough for Big Y to consider putting a sign up and requiring masks when people go in, especially as numbers go up.
Right, as that's the largest, grocery store in our town, would it make sense for you or someone from the Board of Health agent to reach out to them and say, we've heard this concern from community members who are considering taking their business elsewhere, if we provided you with a sign, would you be willing or would you consider putting it up?
To go down and see the manager at Big Y and have a conversation with him.
We've done that with him before, and he's been pretty, they had ordered signs before when it was really,
But I'm surprised that the corporate office isn't, there are enough of these stores around that they're not saying anything. I will stop in and see the manager and talk to him first, but I think I'd also like to call the corporate office and see what they have to say.
Yeah, I think that's reasonable.
And absent COVID, we're still just busy with all the ordinary stuff that goes on. And it's, we're getting annual permits out. People are coming in. It'll be busy, and real estate is still moving. We still have a lot of Title V inspections, and Nicole can tell you about that.
but
That's it, yeah.
All right, thank you, Jerry.
Alrighty.
All right, moving right along to health agent updates.
as Jerry said, yeah, I brought in a stack of checks this morning. It feels like it's been the Title V's particularly, and it feels like a lot of repair perks still going on from people whose systems may have been a little bit overused during COVID. There's a lot of that happening right now too, whether it's just components or whatever. So ground's still not even solid enough to even think about stopping yet, so it's not close to freezing. So I think everybody's going to keep right on going. I've been reached out to, just actually got a message now about another one, so I think that's going to continue. It seems like I just looked the other day and there's a bunch of homes that are listed that I haven't gone out for yet, so I anticipate that continuing. We've had a lot of plans being reviewed for those repairs and the new systems going into, so Jerry and I are kind of dividing and conquering on those plans, trying to get them back as fast as we can for people. It feels like we're getting a lot of plans where it's like, our house closing is in 3 weeks, please hurry. So we're trying to get those done for people as fast as we can, and I am embarking on my last run of the routine retail inspections right now, so try to get those wrapped up before the end of the year.
Do we track revenue from month to month? Just curiosity, like revenue
We
from,
individually for the department, you mean?
yes, for the Board of Health?
No.
I was
That's
just curious.
Done through the accounting department. We're supposed to get an expense and revenue report monthly, and that's how we keep track of it.
I was just curious if, comparatively, what it looks like in 2021 in comparison to pre-pandemic for
I can
for
go
volume of
back
work.
to previous years if I get an expense and revenue report from the accountant's office. Then you can check and see what it was like in 2019, 20, 21.
Right now, it's a lot of like, I go out for the Title V, it's failed, so you get a check for the Title V, then you go back out and get another check for the perk because you got to repair the system. So some of these are becoming, it's not just like, thank you for the $150 and you move on, you're also getting the perk money going too. So that some of these have been,
Does the accounting department get a copy of a bill or receipt that you give to the homeowners, the property owners, so that they know what to expect?
They get a cut with the turnovers. When we get a check, the turnover, there's 3 copies. We keep one. One goes, it has to be signed off by the treasurer's office.
Yeah.
And they keep 1 copy, another one goes to the accounting department. I mean, I can,
But you have a list of what to expect, so you know who's not paying you.
Oh, no. They pay before they get any service.
Okay.
yeah.
I was just curious to see if there's,
No, I don't bring the paperwork back without a check.
Okay.
I know better than that.
I was just curious if there's been an increase in the number of tests being done from 2 years ago to
I think
today.
there's definitely been an increase in repair perks.
Repair perks.
I think, and all the guys that are out working have said, it's just, everybody was home. So if you had little kids that were normally at school and everybody was just home running the water and the bathroom and all the other things repeatedly,
Dishwasher,
anybody's
laundry.
system who was like on the fritz, it's gone now.
So if there's any way to get more information about that, just because I think, COVID's kind of here to stay, it would be good to be able to plan around that a little bit, especially with the
Well, I think we
budget.
had a real estate market that was really inflated, and that drove a lot of the sales, because, let's face it, I think you're gonna see the market come down again.
It'd be just good to know, right? Okay. Anything else, Nicole?
I'm good, thank you.
Okay. So for other business that cannot wait for a posted meeting, I just wanted to mention the conversation I just had with Dr. Bonneville, who was going to try to make it for the beginning of this meeting, because they're having a meeting for Hampshire Regional High School at 6 o'clock. They are approaching 80% between staff and students, 80% vaccination rate. And Desi said that if a school meets an 80% threshold, that they can make an individual decision at the school, from the school committee, in concert with the Board of Health, to consider allowing students who are vaccinated to go into the school unmasked. Of course, right now with new variants, spread of cases in town, and some overwhelmed school nurses with the volume of test and stay, the consensus was that they were going to defer any decision about masking in school, and part of the challenge there is if they decide to allow for students to go into the school unmasked, if they're vaccinated, it then puts the responsibility of mask policing on the teachers, which, that's a lot of work. It's also a lot of health knowledge, right? So teachers then become responsible for being aware of who is vaccinated and who is not vaccinated, which is protected health information. And I also spoke to Lauren Holtz, who said that she really felt like it should be all or nothing, that trying to enforce this rule of 80%, enforce this mask mandate for vaccinated students versus unvaccinated students was going to put an undue burden on the school staff. Also, I spoke to Stephanie Foss about the same thing, and she felt very similarly that it just didn't feel like the right time to be trying to implement something like that. Additionally, the school is having a much harder time, Norris School is having a much harder time managing the volume of work needed between contact tracing and test and stay protocol. So students who are exposed or identified as a close contact are then allowed to test daily, so that they can continue staying in class. And so you can imagine that the more close contacts there are, the more daily tests that they're going to have to not only do, but then they're also calling the family to set up the parent to bring in that student. And so the feeling at Norris is that it was hinging on becoming feeling unmanageable.
It's labor intensive.
Right, because it's a lot of work. And again, on top of everything else that's going on.
Right.
The other thing that Stephanie mentioned about the 80% masking threshold is that she reached out to Desi to see if there was any scientific data or reasoning for suggesting an 80% threshold. Like, where did that come from? Why all of a sudden when there's 80% vaccinated, you can just allow those people to go unmasked in the school? And she said she reached out to them numerous times and they never responded to her with an actual answer. And I believe Dr. Bonneville mentioned that they had also been trying to reach out to get some more information about who created this plan. And The only other question I kind of posed in a conversation was, if we did have a significant increase in cases, what the plan would be, what would be required in order to re-implement masks, which of course, once people are used to not wearing a mask, it's going to be much harder to re-implement mask wearing. And so if there was an outbreak, it's not like you can snap your fingers and then say all of a sudden everybody needs to wear masks again. I believe that I would have to go to a school committee meeting for a vote, which might be 3 weeks away.
Is there any way they could give the kids maybe, more mask breaks, let them go outside at least for some fresh air?
Are you talking about North School?
Without either one. I think the North School does have the little kids go outside anyway, right?
I would think
They've been
so.
having snack outside in most classrooms, and I'm not sure how much longer they'll be able to do that.
Yeah, it's getting a little cold.
So who is going to decide whether or not they can remove masks? Is that a decision that the Board of Health needs to make, or that Stephanie and Dr. Bonneville are going to make for Hampshire Regional?
I think the documentation says that it's a decision of the school committee made in concert with the Board of Health. So it's not like the school committee is just going to go make a rogue decision without and I know Stephanie has been in touch with you on pretty much a daily basis. And so I feel like those decisions won't be made in a silo. It sounds like they're going to put it on the agenda for Hampshire Regional High School because that's the only local school that's approaching that 80% threshold. I think she said that they were at approximately 77%.
I think they're looking for your recommendation.
Right,
though.
so does it make sense for us to vote to make a recommendation to say, for example, that we think masks should be continued to be worn in light of new variants and higher levels of cases?
Yeah, especially at least through the cold months, because I think that's when there's just more people constantly inside, whether that's school or home.
I think it makes sense to vote.
Yeah.
And I also think it, just so parents have the opportunity to speak about it, that they were planning on putting it on the January meeting for their, January agenda for parents to be able to come and speak about their concerns, so that way maybe we could hear some of what the families are feeling. But I'll be happy to vote to keep masks in school until it can be reevaluated at a future school committee meeting.
Despite the percentage of vaccinated students.
Right.
Regardless of the percentage.
Is that a motion?
I'll make a motion to continue masking in schools despite vaccination rates.
Seconded.
Third, aye.
So there's an additional note in Stephanie's email saying, referencing over the past 2 weeks, there's 21 new cases in our school community. 8 of these cases are in the same classroom. We do believe there's evidence of transmission at school in this 5th grade classroom, specifically during lunch. They've reorganized the cafeteria. They could use some guidance or feedback on whether to consider doing something other than DESI's protocol in response to increasing COVID cases.
And that's the 3 foot, just for discussion,
Right.
that's 3 feet in between students.
In the lunchroom, they were doing 3 feet? I thought they were doing further apart in the lunchroom. Am I mistaken?
Oh, I'm sorry, I thought so you're talking specifically about lunch?
Well, it's interesting because they referenced lunch. I have a student in that class, and it seemed like there was some within the table classroom spreading from what I knew about it, but I'm not in the school. Obviously, I'm not a nurse. I only know what my child told me.
Well, specifically to that comment or question of looking for guidance, why not lunch in classrooms again, if lunch is the biggest concern of increased spreading?
I think they actually have more room in the lunchroom than in their classroom. Because they start lunch, the earliest lunch group someone told me was at like 10:30 or 10:50 or something. So they've spread out the lunch period so that lunch is more de-densified among the grades.
And are they required to stay within their classroom group, though?
Yes, they have a lunch buddy. They can only sit with one person that they've been assigned to.
Okay. All right, well, I guess if they're going to be with the same group of kids, that they would be
But
within
within the classroom, there's tables, and they're sitting at the table within 3 feet of one another, and it seemed from anecdotal evidence that there was spread within the table. So I don't know if there's an opportunity to consider, when possible, to increase to 6 feet in classrooms, or
I feel like this was a persistent discussion last year, and there's just not enough room. I think we could say as often as possible, right? But I think, to be fair, I feel like this has been on the table since the beginning of trying to figure out how to space students out as much as possible.
Or maybe I mean, it's hard, obviously, in the subject classrooms, if they're doing science and there's an experiment or something, it lends itself to sitting at a table. But I don't know if there's any times or benefits to recommending that people sit at individual desks, because then it's more spaced out. You're not facing the person, you're all facing forward. But maybe that's not possible with the subject matter and the way the classrooms are.
Yeah. I think the other way that I thought that we could, and I mentioned this to Dr. Bonneville, is if there's any messaging that we can do to try to increase vaccination in the classrooms, just because you mentioned that it seemed like there was lower vaccination rates, especially at Norris School. I know it's still early of children being eligible for vaccination. Dr. Bonneville said that it goes out weekly in newsletters for anybody who's going to school about any upcoming vaccine clinics or local places to like that the schools are hosting. I said that, you know, if there's any messaging that we can do to support education about vaccination. I've seen some good webinars online about pediatric vaccinations. Maybe that's something that would be worth sharing.
Yeah, that's a great idea, because I was disappointed to see the numbers even of first doses, because almost every grade at Norris School has about 65 to 75 students, in my understanding, and the fifth grade class is the only one with more than 20 people that even got a first shot.
I was going to ask, what is the number of students across
Well, I think
Norris?
parents probably were a little reluctant in the beginning. They wanted to see what was going to happen with the vaccine.
And I agree, and I understand that. But maybe as time progresses, there will be more scientific data or information.
They may have taken children to their own pediatricians rather than, you know, to the clinic.
Are we sharing, or is the school sharing information about how many cases there are active in the school with parents and family?
Yes.
So everybody knows there's 21 cases in
Yes,
Norris.
and if it's your child's classroom, you get detailed updates by email for every new
Because I think
case
that's
involved.
important. I hate to,
Yeah.
I don't want to say a scare factor, but like that's real data and evidence that this is, you know, getting worse, especially in this age group, so it's
Yeah, it
important.
might be helpful if the nurses, or Stephanie recommended that people that got their vaccine elsewhere submit that data to the nurse's office, because I never saw that anywhere. It wasn't specifically asked for, and, you know, like I, as a parent, chose to submit that because I knew the school was tracking that, but maybe other people aren't aware of that as a recommendation or an option.
So it's definitely worth asking. Now, the other thing that Jerry had mentioned was the opportunity for Southampton to host a vaccine clinic. And I think it's a great time for us to host a vaccine clinic. Of course, I was also curious about space to host that clinic. If that would be done. I know we're, you know, trying to be judicious about bringing outside people into town hall, so I just didn't know if there was a...
Be able to use the school again, too, and have the fire department fog the room first. Excuse me, I'm losing my voice. And then fog it again afterwards.
Okay. And you had mentioned, just to save you a few words, you have a frog in your throat, about the possibility of hosting a clinic while children are on school break. Is that?
I was thinking, right, when you know, older siblings would be home from college and they're on their semester break, then we can get them for the booster shots, because UMass is now requiring students to have a booster shot before they can go back after semester break.
So maybe, and this was Michelle, so maybe we could ask her if she'd be able to, and I'm not sure if they need vaccinators or if they need, again, need help people to help run that clinic, but The week after Christmas would be a great time to catch
I think that would be good.
So
I'll
last
check with
week of
her.
December, basically?
Well, it's a question mark, right? We'd have to ask if we could have a clinic during that time.
Yeah.
That might be a good time to try to encourage more parents to get their children vaccinated as well, because if people are worried if their children has vaccine side effects, that then they're gonna have to miss work or get them tested, and that's gonna be a delay to return to school, that might be kind of a window of time where they feel more safe to do that.
Or they were already planning on being off from work, so they could bring their children to,
Well, everybody will be back from whatever vacation they've
Yeah.
taken to Disneyland, right?
So the school break for the holiday extends from when to when?
It's a half-day December 23rd for the Norris School until January 3rd.
Oh, wow.
Okay.
Okay.
Yeah,
So, yeah,
so it's
that would be a
full
great week.
between Christmas and New Year's.
so I definitely think that's worth looking into.
So it would be after that Christmas break.
Yeah, like the 29th or 30th, like early in that week before New Year's might be a nice time to do it.
I did, oh, sorry.
I don't think we're going to be able to do it. I'll check with Michelle, but we might be able to do it then.
Because there's no one in the school, the kids are off.
Right.
The kids are off, the college students are
Probably
home.
doing deep cleaning that week too, while the kids are gone.
I think the other thing, just for the record, I spoke to Becky at Walgreens in Southampton, and they were not doing children's Pfizer vaccines because of, numerous reasons, but part of it is just staffing issues and the ability to meet the demand of the number of appointments. So I feel like the more chances we have to give people vaccines in town,
Right.
almost like putting it right out there.
Local and easy. Right.
I'll tell you, finding a Pfizer appointment has been, I've tried to help a few local people find appointments for their children, and Northampton Health Department at the Elks has been pretty good, but, otherwise it's Holyoke or Westfield for Pfizer appointments, or Springfield. And sometimes the appointments are pushed out by a week or two, and that itself could be a deterrent, right? I don't know what I'm gonna be doing in 2 weeks, right? So they might just postpone scheduling, or see if something might come up more local.
Is,
I wouldn't go to Springfield to,
do you know if Southampton Walgreens is doing booster shots? Because
Yes.
they are doing booster
Yes,
shots.
They are
they're doing
doing-
adult boosters.
yeah, it's just the children's vaccines.
Okay.
The Walgreens in Holyoke, like right over the mountain on Northampton Street, is doing the pediatric, but by appointment, and I heard that they've filled up. Like they're booked out a few
Isn't
weeks.
Southampton Walgreens by appointment too right now?
It's by appointment, but they're not doing pediatric
Right, you can't
at
even get a
all.
pediatric
Well, just,
appointment.
I think that everywhere is picking out a little bit. I was just booking for my in-laws, and like the Walgreens in Southampton didn't even pop up for the next like 2 weeks. So I think that because probably of staffing issues everywhere, it'd be nice just to do like another clinic to add to the options for people.
Definitely.
With CVS in Easthampton.
Yes.
Is doing.
They have Moderna, not Pfizer, right? So there's just limited options even for people to bring their children to get
Why
vaccinated.
that is, because they keep saying that there's plenty of vaccine. Is it just whoever's ordering it?
I think maybe there's not enough staff to administer it. I'd heard that the 2 pharmacists working in Southampton were each working like 80-hour weeks or something.
Yeah.
But are you asking like why Moderna and not Pfizer?
Yes, I'm
Yeah.
just wondering.
Yeah, it's been interesting to see like which is offered where. I don't know.
Maybe it's storage. Maybe they don't have the appropriate freezers. Maybe it's distribution of the vaccine. I know that's why they were keeping Moderna at certain CVS's, because they had access either to ship the vaccine to the store, and they were trying to keep it all concentrated at one store, so that way they didn't have to, because you have to store it and, freeze dried. So the more places you ship to, the harder it is to store the vaccine. Okay, so vaccine clinic hopefully, and if that timing doesn't work, then,
Oh, we'll see what they can do with the collaborative. I mean, I know that they've been really busy at the Elks in Northampton, and, we'll see what we can arrange. But I was kind of hoping we'd get that group that's home on semester break as well, and I figured once we got beyond Christmas, actually, then people, you begin to settle down, get your life organized again, and you know, they might be thinking, oh gee, it's time, let's get, you know, the flu shot and do our vaccine.
And they have time to think about it. I did speak to Kate at the Northampton Health Department, and they said that they are slowing down on doing outside clinics that aren't at their designated sites because of staffing, and also because they're able to offer a greater variety of vaccines at each clinic if they just stick to the Elks and the municipal building in Northampton. So they've been not accepting as many requests for outside clinics too, which is interesting. So when I heard that Michelle was interested in coming to Southampton to do a clinic, we're like,
Well, because we're part of that
Right.
collaborative, and we're part of the grant too, so, yeah,
do
she's
it.
more than willing to do it. So I'll give her a buzz tomorrow morning
and we should find out, is it possible to find out if that would be a walk-in clinic or if that would be like a color clinic, so that way, you know.
I think if you can do walk-in as well, a lot of people are going to want to.
I think that's great. I just want to know which it is, so we could post, although I'm sure for the people who are coordinating the clinic, it's really helpful to have people signing up.
Well, you really want to have people sign up so that you know how much, you know, vaccine you need. But if somebody were to be there and just wanted to get, you know, their vaccine, I would hope they would still give them.
Oh, yeah.
Yeah. I'll check with her.
That would be great. Okay, and we should probably reach out to the school, right? If we're talking about doing a clinic at the school. Well, that would only be if it's going to be during that 1 week break, right? Because otherwise there's children in the school.
Right.
Okay. Does anyone have anything else for other business that cannot wait for a posted meeting?
Want to set up here next?
Yes.
Sounds good.
I'm kind of looking at Kate, who has the most variable work schedule.
So are we looking at like the first week of January?
Yes. I don't think we should go much further out than that, because who knows what's going to happen in the next 3 weeks.
Like Monday, January 3rd?
I can do that.
Yeah, that works. 5 o'clock? Is that okay with you?
Yeah.
5 o'clock?
Perfect.
Okay.
Another year.
I know, it's gonna be 2022.
Okay, and with that, I'd like to make a motion to adjourn the meeting.
Jerry, can I borrow your pen? Second that,
Seconded.
oh, third?
Okay. Thank you, everybody.
Sorry.
Thank you.